A few more items we can talk about the day of surgery. We typically perform your surgery in the Stony Point Surgery Center. It's about 100 yards away from my office. And surprisingly, people are amazed, but the operation takes me about 2 to 2.5 hours. That's a little unusual because many surgeons take 4, 5, and 6 hours, and they will keep you overnight in the hospital. I think that's a big mistake because we all know that hospitals are dirty places with a high rate of infection, and so I never want any of my patients to spend the night in the hospital. And I think that's a real key issue for me, is that I want all my patients to have their surgery and go home, because your home is a much better place to recover. We can have you do a couple of other things at home to help recovery, have you sleep in a lazy boy chair or a power lift chair some of my patients have, but it is a real recovery. It is a recovery that probably takes about a month before you're feeling pretty much back to normal. So the first week, you probably are not going to drive a car, and I probably think no one should try to drive a car the first week. The second week, most people are driving again, and they're moving slowly, and they may finally stand up fully or straight because we've tightened those muscles so tight. So the end of the second week is a pretty big goal to reach. People feeling much better. Third week, you feel much better. And the end of the fourth week, people really feel pretty much back to normal. They're not going to the gym, they're not working out, but they really are able to do most of their daily activities without much of a problem.